Did your orthodontist just tell you they're gonna glue this scary metal thing in your mouth? Well, don't worry. In this video, we will cover palatal expanders in detail, as well as go over all of the questions we get daily so that we can calm your fears and you can know exactly what to expect. What is an expander? A rapid palatal expander, also known as a Hyrax expander, is an appliance that is used to widen a narrow upper jaw. There are many variations in the design of expanders, but the most common design has bands that fit around the upper first molars, anchoring the device into place with metal arms that extend forward. The expander has a jack screw in the middle that is turned with a key. Every turn of the jack screw widens the expander, putting pressure on the upper teeth and the jaw. What does it do? The upper jaw, also known as the maxilla, develops as two separate bones that fuse over time. If an expander is used at the appropriate age, the outward pressure of the expander on the maxilla will separate the two halves of the bone, and your body will create bone to fill in between. The end result is a wider upper jaw. Why is it needed? The most common reason to use an expander is to correct a crossbite. A posterior crossbite is typically caused by a narrow upper jaw, which leads to a bite where the upper arch sits within the lower arch. The crossbite can develop on one side or on both sides. This kind of issue can be genetic or can develop through bad habits such as thumb sucking or pacifier use into a late age. If left untreated, sometimes crossbites can lead to jaw pain and TMJ issues, asymmetric growth of the jaws, and excessive wear on the teeth. Patients who have narrow upper jaws may also have a constricted airway and have difficulty with nasal breathing. Using an expander can potentially increase the nasal airway and can help alleviate these symptoms and promote better nasal breathing. Another reason for an expander is to create room for crowded teeth. Because we are expanding the upper jaws or widening the upper arch, this creates more space for the teeth that are crooked. One more reason to use an expander is to prevent canines from getting stuck in the bone, or what we call an impaction. Impacted canines can be a major problem because they require a surgical procedure called an expose and bond plus braces to correct. If these are caught early enough, an expander can sometimes be used to redirect a canine by creating extra room for it to come down. When is the best time for an expander? Age is the biggest factor when deciding if an expander will be effective. As I mentioned earlier, the upper jaw develops as two bones that fuse as we finish growing. This suture can be split safely and predictably in growing patients ages 8 up to around 14 for girls and 15 for boys. After those ages, the suture becomes fused and cannot be split with just an expander alone. If an adult needs an expander, a regular expander won't work because their suture has already fused. Instead, a RPE or a RPE procedure must be used to split the suture and achieve expansion, and we'll cover those topics in another video. What kind of sensations or pain or side effects should I expect? This is the part where I want to reassure you. Most patients don't feel much discomfort at all. Expanders have been used safely by orthodontists for many years. Most patients can expect to feel some pressure in your nose and palate after you turn the expander and some sore teeth. If an expander is banded around the teeth, separators must be used to create space between the teeth for the bands. Most patients tell me that the soreness they feel after this is done is the most uncomfortable part of the entire process. At our practice, we use a customized 3D printed expander from NeoLab that starts with a digital scan and will fit perfectly on each individual. This eliminates the need for separators, which means that you won't feel any discomfort whatsoever from getting this type of appliance. Thank you to NeoLab for graciously making this appliance for this video. One common side effect from the expander is developing a gap between your upper teeth. This means that the expansion is working, and don't worry, this gap is temporary. Oftentimes it will close up on its own, or your orthodontist will put braces on to close it. You may have a slight lisp during the first week, but your tongue will adapt and it should quickly go away. Just keep talking and practicing so your mouth can get used to it quickly. How long do I need an expander? Generally, we want to keep the expander in at least 6 to 12 months after the expansion has been complete. The longer the better, because if we remove it too early before sufficient bone has filled in, there will be relapse and we will lose the expansion that was completed. Are there any eating restrictions? We generally recommend avoiding any hot foods that can get trapped in your expander and potentially burn your palate. Always make sure to keep your expanders clean, please. You must floss and brush normally, otherwise your gums will become swollen and painful, and it will be very uncomfortable to remove the appliance if the gums are grown over it. Any tips on turning the expander? I would suggest having your child or teen lay down on the floor or a couch and hold the light so you can see the screw holes. Then you can position the key in this orientation and turn it straight back towards the throat. One key mistake to avoid is unturning the expander as you withdraw the key. You must withdraw the key towards the back of the mouth or you risk unturning the expander. If you cannot complete the turn, the next keyhole will not be made visible, and you will have to reinsert the key in the original hole to complete the turn, which can be a little bit difficult to do. I want everyone to know that you should not freak yourself out before this appointment. We have some patients who love to read horror stories and watch lots of videos before their appointment because they are nervous, and I understand that, but these stories make them even more anxious. The vast majority of patients do extremely well with this procedure, and there's hardly anything to be scared of. I hope this video was informative and helpful. If you have any other questions or comments regarding expanders, or if I missed anything, please leave a comment below. As always, please like and subscribe for more orthodontic tips and information. Thanks for supporting our channel, and see you in the next video.